Hey everyone, and welcome to the channel. I'm Loren and I am beyond excited to finally hit record and launch this platform. It's something I've been thinking about for a while in regards to providing education specifically for our Australian clientele base, but also delving into the different technologies and treatments that are now currently available in a lot of clinics. For those of you who know me, I am Loren for the Dermal Clinic here in Hervey Bay, Queensland. I'm here creating this channel to delve into the Australian market of the technologies that are out there, as well as a little bit of skincare and products. We can delve into the components and makeup of those, but mainly in regards to the procedures and protocols that are in place in clinics in regards to in-clinic treatments and what they do and how they work. If you're scrolling through social media right now, it is a absolute minefield of different miracle treatments, different trends, things that are going viral, very heavily celebrity focused products, and all these new buzz and crazes that are out there. So as we know, there are also with these trends a lot of before and afters, or what we think are before and afters after using products or getting a certain treatment. I want to build this space that is deeply educational, entirely factual, and fingers crossed it's actually fun to watch, or else you're going to tune out. So this is going to be me trying to give you a new source of truth for all things that are skin science, clinical therapies and lasers, particularly here in Australia, in Queensland where I live. To kick things off, let's do a quick introduction to myself and why you should even bother trusting me or listening to me. I have been a registered nurse for over 10 years. Patient safety, infection control, and knowing the human anatomy very well is built into my DNA, especially after where I have come from. So I did originally start as an assistant at nursing, and I have gone through the educational steps to become a registered nurse. And since I'm a sucker for punishment, I have then gone on to do many different courses, associate degrees and other educational and health certificates to get me further qualified to better support my community. I have worked in many different fields throughout the hospital. I never really knew exactly where I fit, but I did wander around from ward to ward, going into the emergency department, women's health, medical radiation oncology, surgical, and also ward nursing, private, public, and ended up landing in the surgical field for the longest period of time, and that included doing all the aftercare and surgical wound revisions and follow-up. And wounds are amazing, and they do come back to our skin, which is our largest organ. People sometimes ask me, how did I go from the chaos of the hospital to this clinic that I've created? And the truth is, our skin is our largest organ. It is the ultimate telltale for everything. It can tell us exactly what's going on inside. So just by looking at your skin, you can see if there's a nutritional deficiency. I can see different indicators for things such as diabetes, poor circulation, also different autoimmune diseases, all just from looking at the appearance of your skin. It's absolutely incredible, and that's all without me having to touch you at all. So it's a little visual health check that we should be teaching all as nurses, doing our head to toes, but it's something that once you're very good at it, you can absolutely tell a lot from it. So I take all this information and all this experience that I have learned over the years, I combined it all to create the Dermal Clinic, because I felt there was a gap in the market, especially in our regional area, in between very overloaded GPs. So I've put all my knowledge together and done even further education to do an associate degree in dermal science, and I have also purchased some pretty cool lasers to get some incredible results for our clients here in Queensland. I've also gone into, again, because I want to do things very correct, and it's something that's just instilled into me to do the best I possibly can. I'd also done a certificate with Cert Health Cert, that has allowed me to operate a dermatoscope. So we do a skin cancer and a bit of a skin health check before having any laser-based treatment done. And I'll go into why that is a ridiculously important thing before having any light-based therapies in a different video. But it's really important that I have made myself as educated as I possibly can to deliver this video even, but also to make sure that I'm delivering accurate information and education to anyone that comes and sees me as well. On top of all my medical background, passion and quirks, I am a mum to 2 incredible little children. Honestly, I am a massive education junkie and my kids love me for it, and thank goodness they have the ability to put up with me rant on and educate them even about what I do, and they're so inquisitive even at the ages of 3 and 5. So I am very, very grateful to be a mother to them, because I don't know too many other children that could actually put up with me. I do spend, not that I have free time as anyone with children or a business or a husband will know, but with what I do have, I am continuously diving into why is this a trend, what are they claiming, what are we doing with it, and seeing if it is true or if it is just something that they put on the internet to get the sales, which is against what I can actually do as a registered nurse, and ethically I just can't do that. Now, everything that we say in here is obviously of my own opinion and my own research, and I always encourage anyone to do their own research. Even when you come and see me, I say if I'm not gelling with you, or if you don't believe what I'm saying, please go get a second opinion. Use the research and the technology we have to go out and find your own truth. You're going to get a better result if you believe in the treatments and therapies and products that you are using. And I do apologize if you haven't noticed, I ramble and I go off on different tangents. I do apologize for that. But back to why you should maybe listen, or at least start doing some research on some of the topics that we talk about is, I just wanted to bridge the gap, and I am passionate about that. I grew up in a very small community, not overly small, where we were beef farmers and citrus. A very small high school, and I never did well in school. Hated it. I was very hands-on. I only did it because it was where I could see with my friends, and I didn't really aspire too much straight out of high school, but I did very well for myself, securing full-time employment and going on to do wonderful things. It was only when I started working at the hospital, where I started as an AIN, is that our beautiful director of nursing believed in me more so than I think I did, and she really encouraged me to continue on with my education journey and do my RNs, which I did, and that has now brought me to the beautiful community of Hervey Bay, which is a lot bigger than what I'm used to. But we still have a gap where we don't have a lot of access to dermatologists. GPs come and go. There aren't many that have open books, and our entire community is growing very, very rapidly and very quickly. And I did notice there was a gap, especially working at the hospital, of these beautiful people coming in and having their lives changed through surgery, and the aftercare was a little lacking, and that's what we can offer with our public health service, and that's nothing that is going to change. So I decided I wanted to do more, I wanted to have better results, and I really wanted to track my own path and do treatments how I would like to do them, because I believe that what I've researched and what I offer is up there with what I can actually offer. Of course, there's people out there that can offer better for me, that can offer you more than what I can, but for what I have and what we're doing, I think we're doing a good job for this community, and I wanted to start doing this education with everyone else, because a lot of the people who are coming in and seeing me are asking me about what they have actually done and their research on, which I've seen on like TikTok or Instagram or Facebook or YouTube even. And it's just trying to debunk all that information, because they need to realize that just because it works for someone doesn't mean it's going to work for them. Their skin's very different, and it's how they use it, and it's about consistency. So I wanted to start making these videos to say, one, I'm going to send these to my clients to be like, this is exactly what this treatment does. You don't have to listen to me or remember anything I say in clinic. You can go back and watch this video and do your own research. So I thought if my clients would like these videos and it's going to explain some of the things that I do, surely someone else is going to ask these questions as well. So my main mission with this clinic and now this channel is just to bridge the gap and to tackle the complexity of information. We tackle complex inflammatory conditions, we assess and treat impaired skin barriers, and we're starting to look at fighting back against sun damage. And that brings me to a super important point, is that we cannot copy and paste a USA or a London skin care routine, and we're not going to be using the same technologies because Queensland faces and Australia standards are ridiculously different to the rest of the world. Overseas, they are mostly fighting chronological aging or city pollution, whereas in Australia, we are battling the highest UV index on the planet. Our skin is under relentless year-round assault. So we are dealing with severe photoaging, stubborn pigmentation, and barriers that have been compromised since childhood. We have to treat the environment that we live in and take that into consideration with all our treatments and products very seriously if we're going to get a result. So as I previously mentioned, I am a registered nurse and I am governed and registered with APRA. So as part of being a registered nurse with all the new regulations and everything that have come in, there's a lot of things that I have to be very careful about saying. I can't glamorize any of these procedures, which I won't do. It's all going to be very factual, which might not be for you, but that's what I am allowed to do. And that's basically what I do as a nurse, to provide education for you to make informed decisions and to feel confident in your decisions. We do not really post before and after photos unless very in-depth contracts have been signed or consent forms have been signed. I don't need to publicize other people's before and after photos because that's their own skin journey and it's completely 100% up to them and what they would like to share with the world. It's not my decision. So one of the things that I do get asked a lot is, oh, do you have a lot of before and afters? I do, but they're not for me to share. They're for my clients and my clients alone. And if they choose to share or if they ask me to share, then yes, I will share them. But also as part of being a nurse and governed by APRA, we have to be very careful about what we post. It's not something that I would like to do. They can shut down our social media account. They can make our lives very interesting. And again, I am always here for regulations and to abiding by the rules. And they are a governing body and they have kept us safe for many, many years. So I just want to make that very clear that some of the things I say you might not agree with. And that's okay. We're all allowed to have different opinions and that's fantastic. Even different doctors don't all practice the same way and perform a procedure the exact same way. But we do have to be mindful that I am a registered nurse and there are things that I can and can't do to remain above board with APRA, and I'm 100% okay with that. And I feel confident enough that this is going to be a very safe space and we're going to approach things in a very above board manner that would make APRA proud, I'm hoping. We'll find out. So anyway, that's me. Stay tuned. I feel the first video we're going to do will probably be on laser genesis. Just because it's one of my favorite treatments, and also it's one of those treatments that everyone says what it does but don't actually explain how it does it, especially considering what it involves, and that will be in the video, I guess. Don't delve into it here, we'll be here all day. So until next time, next week, take care of your skin, take care of yourself, put on your SPF, and I will see you in the next video.